Orgasms are pretty complex. You need a lot of things working right and healthy for an orgasm to occur. Your brain, your nerves, your blood flow, your hormones, your spinal cord, your attention, your safety, your stimulation, a skilled partner, and a knowledge of your anatomy. There are a lot of options for problems with orgasm, but you need the appropriate diagnosis. Why does sex hurt? This is your body's way of telling you that something is wrong. Pain with sex is very common. The problem is that we have normalized it. When I talk to patients about pain with sex, I like to break it down into 3 areas. The first area is the
Content of the Disruptor podcast is for informational purposes only and does not constitute medical advice. Please consult your healthcare provider for personalized guidance regarding hormone therapy and all your medical decisions.
Miracle Melts for Playground, deeply hydrating, hormone-free inserts powered by hyaluronic acid. These work with your body to soothe and relieve painful sex and vaginal discomfort from vaginal dryness. This isn't about masking symptoms. It's about real relief. Miracle Melts are brought to you by Playground, co-founded by Christina Aguilera and a team of lovers, mothers, entrepreneurs, and a true sex connoisseur. Their mission? To normalize conversations about sex, support women's sexual health, and to remove stigma, because every woman deserves to be seen, heard, and cared for. Playground is for every woman who's ever felt dismissed, suffered in silence, or been told to just deal with it. If you're ready to finally feel relief, use my code Dr. Somi for 20% off your first order at Playground. Is testosterone really for women? Yes. Women naturally make testosterone. It plays a role in sexual function. And testosterone therapy is right for a lot of patients. The dose has to be appropriate and it has to be monitored with follow up. And like I said, there's a global consensus statement that actually supports using testosterone for women. So if a doctor tells you testosterone is a male hormone, why are you asking for it? Once again, run. Why does sex hurt? So I want you to hear me when I say this is your body's way of telling you that something is wrong. Pain with sex is very, very common. The problem is that we have normalized it. And when we normalize it or dismiss it, I can't tell you how many delays and diagnosis that leads to. I've had women that have presented with fibroids, and I asked the question, have you been struggling with pain with your periods? And they're like, for years. I'm like, why didn't you seek out help? And they're like, well, every woman in my family has painful periods. So I thought that that's just the way we had to live. So we need to stop being our own barrier. There's enough barriers to healthcare as women. We need to stop being our own barriers to healthcare. So pain with sex is common, but it's treatable. So you don't have to live with it and it's not normal. And when I talk to patients about pain with sex, I like to break it down into 3 areas. And so we can figure out together where the pain is, and then we can hone in on any diagnostic tests that we need to do, any examination that we need to do, any imaging that we may need to do, labs that we may need to do. This is why you guys really need to see an expert and not just buy something on the internet that says this is for sexual pain. And so the first area of pain that women have is the outside, or what we call the vulva. A lot of women mistake this as the vagina, but the outside is the vulva. And the vulva includes your labia minora, your labia majora, and the vestibule, which is the area inside the labia minora, or right around the opening of the vagina. And this can feel like a burning, a stinging, a tearing, or oh my gosh, I can't even stand wiping anymore, Dr. Jvade. There are multiple contributors to this. It can be hormonal changes from perimenopause or menopause, postpartum, breastfeeding, There can be skin conditions like lichen sclerosis. There can be infection or inflammation, or even irritation from products. Pain in this area is typically called vestibulodynia or vulvodynia. Treatments obviously can include removing any of the irritating agents, optimizing vulvar care, using topical hormones or pain medications, or using moisturizers. We may also prescribe localized hormone therapies, pelvic floor physical therapy if we feel like it's a tone issue. So that is why an exam, labs, diagnosis, all of that is so, so important so that you are given the right treatment option. There is vaginal pain, and our vagina is the actual tube. And this patients will describe as friction or dryness or burning. This can sometimes be a part of menopause called genital urinary syndrome of menopause or hormones change. The vaginal walls normally have these folds called rugae and act like an accordion and are thick and pink. And as we go into perimenopause and menopause, we start to have this collective umbrella of symptoms of vaginal dryness, irritation, more likely to have infection, both vaginal infections, urinary infections, and bladder infections. And it's because of the declining estrogen levels that the walls are getting thinner. That tissue becomes paler, less pink. We start to lose those folds, and our pH also starts to change. The pH starts to increase because the microbiome of the vagina also starts to change. And treatments can include lubricants, moisturizers, and obviously localized hormone therapy. There are two types of localized hormone therapy. A lot of people know about estrogens. They can come in suppository form, they can come in cream form. There's actually a ring that delivers estrogen locally. One of my personal favorites is Intrarosa, which is prasterone or DHEA. It breaks down into estrogen and testosterone, so it's a duality. It actually helps with all the symptoms of vaginal dryness and GSM and preventing urinary tract infection, but it actually helps with some of those domains of sexuality that I was talking about. So it's almost like a two for one. And so if you have a choice, between intrarosa and localized estrogen, for some patients, if you're struggling with sexual function, I will tell them, hey, intrarosa may be a really good option. And if it's not covered by your insurance, your doctor can always compound DHEA for you or from a compounding reputable pharmacy. Deep pelvic pain. This can feel like a deep ache, sharp pain, when I'm having sex. It feels like he's hitting something, or it gets worse when I'm going to the bathroom. This can be pelvic floor dysfunction, endometriosis. That's when tissue that looks like the inside lining of the uterus kind of ends up outside, whether it's on the ovaries, the lining of our intestines, inside the pelvis and the abdomen, and that tissue doesn't realize it's not where it should be, and so it responds to the normal hormonal changes of our cycle, and this can be very, very painful, and it can lead to scar tissue and adhesions, often requiring surgery or medications for endometriosis. Fibroids, which are usually benign tumors that grow in the uterine cavity, in the muscular layer, or hanging off of the uterus. I think I explain to patients, think about the uterus like an orange. And the inside part, where you can, like, when you peel off the top of the orange and you look in the middle, that little cavity, that space, that's like the endometrium. The fruit of the orange is the myometrium, or the muscular layer of what causes cramping or contractions. And then the outside peel is like the serosa. And so fibroids can grow kind of in any of those areas. Ovarian cysts or masses or tumors. There are a multitude of things that can be going around in the pelvis. Previous surgery, previous infection can all leave scar tissue. So oftentimes we will do an examination. The gold standard of imaging is initially just getting a pelvic ultrasound. That's typically covered by insurance, especially with the diagnosis of pelvic pain. And treatments can be pelvic floor physical therapy, it can be medications, it can be surgery, just really depending on what the diagnosis is. There are some practical tools that can help with sexual function beyond medications. There's an O-nut. So for anyone who has babysat for a child or or had a child of your own, those Fisher Price rings. This is meant for couples that want to insert in the vagina, whether it is a tool or a penis, but these are stacked rings that you can place on a male partner or a tool. And they are medical grade rings that basically control the depth of penetration. My patients love these because they're like, oh my God, when we first started trying to have sex, we used to need 4 rings and now we're down to 2 rings. And so, super cost effective, won a ton of design awards. The founder has an amazing story. She struggled with sexual pain and basically was told, you're going to have to live this way for the rest of your life. And she includes this beautiful note that is very encouraging and empowering to women about their sexual health care. So that device is called the ONET. And then there is a device called Kiwi, which is it vibrates, but it vibrates not in the typical way that you think to be used for a vibrator and an orgasm. It can be, but we know in medicine that vibration can be a treatment so that our brain is thinking about vibration rather than the pain signals. And so you can use that around the opening of the vagina before or after intercourse to help. It also increases blood flow and reduces, the pain signals. Um, so bottom line, pain is signal. It's not a lifetime sentence. There are so many evidence-based treatment options. Why am I having problems with orgasm? So many women are so hesitant to come forward and talk about this, or they don't even know that there are actually treatment options for this. And so, orgasms are pretty complex. You need a lot of things working right and healthy for an orgasm to occur. Your brain, your nerves, your blood flow, your hormones, your spinal cord, your attention, your safety, your stimulation, and a skilled partner are all required, and a knowledge of your anatomy. It's very interesting to me that women, we have the sole organ dedicated to pleasure, the clitoris. It has thousands and thousands of nerve endings. And that is why you need to make sure that there's not a skin condition causing the clitoris to be covered because the majority of the clitoris is internal, anyways. But there are major category problems of orgasm. So, number one is timing. It all of a sudden takes a lot longer than it used to, or longer than your partner expects. And then you kind of get into your head and you're thinking about, oh my God, this is taking forever. This is embarrassing. And guess what? When we get into that mindset, orgasm becomes even more difficult. Complete absence. Um, there are women that have never had an orgasm, or there are women that used to be able to, and now it's gone. And or there are women that can by themselves, but not with their partner. So there's a lot of dynamics at play there. So timing issue, number one, complete absence, number two, diminished, meaning you orgasm, but you're like, wow, damn, it's not like it used to be. It's a lot weaker, less satisfying, or just, I had a woman tell me one time, she's like, Dr. Javad, it takes a jackhammer to get there now. And this is usually a pelvic floor issue. And then there's a very, very interesting type of orgasm. It's the one that I've seen least often in my clinical practice, but I've been doing this for 2 decades. And it's something called anhedonic orgasm, meaning you have the physical contractions and you can feel the positive pleasure or sensations, but you don't get any of the euphoria. None. But there are treatment options. And so I want to tell you one of the biggest killers of an orgasm. So if this is your take home message, is attention. We are so busy as women. We are paying attention to our children and what we didn't do at work and the car line and the grocery list and meal planning, and we can't focus on pleasure. And if we cannot focus on pleasure, we are not going to be able to orgasm. Inattention is not a great thing. But orgasm requires a specific type of intention to be present, embodied, non judgmental. And if your brain is so busy doing performance reviews and to do lists or self criticism, your nervous system can't drop in and relax enough for you to be present in the orgasm. So, what are treatment options? There are topical medications, there is hormone therapy, there is pelvic floor physical therapy. We use Adderall for some patients. But specifically for those that have problems with attention. There are clitoral pumps, there are vibrators. Some of the medications that we talked about for low desire actually show that they help with orgasm as well. Uh, there are topical creams that increase blood flow, that contain testosterone. So there are a lot of options for problems with orgasm, but you need the appropriate diagnosis and to discuss the treatment option that works for you. Can women use Viagra? Yes, women can use Viagra. Um, it is not FDA approved for women, but this question comes up all the time. It just depends on what problem we're trying to solve. Viagra works by increasing blood flow. So, where there may be a blood flow issue to the clitoris, because both the penis and the clitoris, they engorge with blood and then fill up and then release the blood when we're having an orgasm. So, it's a pressure issue, it's a valve issue. And so, if we think that blood flow is the issue, then, topical Viagra, and we can compound it for women, it can work. But we have to remember the whole biopsychosocial approach. We have to remember to address all the domains of sexuality. We have to remember to address low desire, stress, burnout, relationship. So if we just treat the blood flow and don't address anything else, um, it's not going to be a magic bullet for everyone. So you have to think about it. It's one of the tools in the toolbox that we use, but it's not just, oh, yeah, just give her some topical Viagra and everything will be fine. Can vibrators offer a medical benefit? Yes. I love this question because it reframes vibrators as what they are. I call them sexual health tools and not toys. And the vibrators are evidence based. They help with arousal, they can increase blood flow, they can increase stimulation, um, they can help with orgasm, they can help with pelvic floor strength and rehab and make those muscles around our pelvic floor stronger. They can help with pain and vaginismus. Vaginismus is the involuntary contraction of the muscles surrounding the vaginal opening. And so for some patients, we can use them for graded stimulation and can help support desensitization or even fear or guarding because they are self used. So you have control of it. And for patients with vaginismus, oftentimes pelvic floor physical therapy, vaginal Valium, medical grade dilators that slowly will help relax or open the vaginal opening. One of my favorites is Millie because it is actually adjustable and you only have to insert it once and then you dial it accordingly. How do we formally diagnose orgasm issues? So, a great evaluation can involve a detailed history. When did it start? Has it always been that way? The context, is it only when you are by yourself, or is it with a partner, or the opposite? Is there pain involved? Are there medication changes? Are there issues going on with mental health? Is there any change in the relationship or the relationship dynamics? A focused pelvic exam, both looking at the anatomy, but also the tone of the pelvic floor. Labs, when appropriate, looking at things like hormones and thyroid. And then treatment options are removing a medication that may be causing it, hormone therapy, localized hormone therapy, topicals for either discomfort or to increase blood flow, pelvic floor physical therapy. There's a great company that's available in all 50 states called Origin, vibrators and devices like we talked about. Um, and then mind body approaches. So, sensate focus, guided erotics, therapy, and in select cases and under clinician guidance, medications that can help support attention or arousal issues. And that's where Adderall is, can be considered. Bonus questions. What are the best localized hormones and what do they do for my sexual health care? So, localized hormone therapy, whether it's a topical, whether it's a ring, whether it's a suppository, they come in so many different forms, really depending upon lifestyle and symptoms. They can be a game changer. If you think about it, sometimes the patient says, I don't want to have sex anymore because every time I do, I get a urinary tract infection. And for those of you ladies who have had a urinary tract infection, I don't blame you because I've had one too. And if every time you had sex, you get a bladder infection, of course your desire is going to disappear and you're not going to want to be intimate. And so localized hormone therapy can help prevent those infections. So when we're treating this umbrella syndrome, genital urinary syndrome of menopause, when it starts to creep up in those perimenopausal, menopausal years, and perimenopause can be 7 to 10 years before menopause. Menopause occurs, the average age in the United States is 51. 51 years young, I like to say, being 50 myself. But you are going to treat genital urinary syndrome of menopause with moisturizers, lubricants, but then localized hormones. And localized hormones not only restore the anatomy, so I talked about the thinning of the walls and the loss of collagen, elastin, and decreased blood flow, but I also talked about the pH changes. When our vagina is more acidic, um, it tends to fight off infection better. That's why things die in our stomach too because of the acidity. And so when the pH increases as we go into perimenopause and menopause, it renders us more likely to have infection, not only of the bladder or urinary tract infection, but also of the vagina. And so localized hormone therapy restores the pH, helps with tissue quality, elasticity, and restoring some of the anatomy, reducing the recurrent urinary tract infections, and just overall improvement of vaginal health. And so the options that you will hear a lot about are localized estrogen cream, estradiol, an estrogen containing ring. But I really want to break down Interosa a little bit more. It's called Prasterone or DHEA. And it not only helps with GSM, like we've talked about with the tone, the texture, the decrease in the urinary tract infections and vaginal infections, but also helps to improve some of those domains of sexuality that we talked about earlier of the FSFI. I get asked this question all the time, I think because I'm a sexual health expert and also because I'm a woman and I'm also in the demographic that a lot of my patients are in. But like Dr. Jabade, what are some of your favorites? And I love femtech. It's not just a catchy word. It's technology that is improving healthcare for women by reducing barriers, by increasing access, by increasing innovation, by bringing healthcare to patients and in different ways and meeting them where they are at. And so some of my favorite lubricant brands. Playground, what I love about Playground's lubricants is that they have worked with the FDA on clearance for some of their products. So you know that they're safe and they do what they say. Because that's what the FDA is there for, to make sure that things are safe and that there's not a lot of adverse events and that products and medications do what they say they're going to do. But I also like it because they've curated products for life phases and so really individualize their products. Stripes, amazing brands by Naomi Watts. They have a couple of great, not only lubricants, but also vulvar moisturizers. So, really tackling the issue of dryness and pain. Foria is CBD infused, and so one of my favorites because it's a little bit different and contains a unique ingredient, and a lot of patients who've tried it like it. You can also use the oil for massage, and then also for intimacy. Favorite vibrators. There are so many vibrators on the market now. And what I love about them is back in the day, they all looked like purple penises. And now I love them because they are designed with women's bodies in mind. They are discreet, they are elegant. And so some of my favorite vibrators and vibrator companies are Dane. Dame actually makes one that's hands-free, so it can be used during intercourse. Their vibrators can also be used for solo play. Plus One has so many different vibrator types, and their designs are also elegant. There's a smart vibrator called Lioness that actually can track your orgasms and give you information about your own body. Pretty fascinating. One of my favorite apps for sexual health is called Dipsy. It's audio erotica. So I want you to think about it as romance meets mindfulness. So a lot of times there can be a discord between partners, and one partner may have a lot of spontaneous desire, and the other partner may have responsive desire. And so a lot of my patients will listen to these sexy stories. Pick your characters, you pick how saucy or sexy you want the story to be. You can really tailor it to you and what turns you on. But a lot of women who may opt for medications or hormones may add this as an adjunct or may say, hey, listen, I'm not quite ready yet to go to therapy or to take a prescription medication or to start a hormone, but I do want to try something. And this is can be done from the privacy of your own home. So I love this. Once again, it's called Dipsy. There are some great tech companies to know. Taboo. So Taboo is a sexual wellness brand, and what it does is chooses intimacy essentials designed to support women through their life changes. And they combine products and education, and they deliver it to you. And then a really personal favorite that I am actually a customer of is called Aria. This is a couples focused intimacy platform and it acts like an intimacy concierge. And so you fill out, and I've had so many people thank me. And no, I do not work for this company, I do not consult for them, but I'm really fascinated with their approach to sexual health. And I love the fact that it really meets people where they are, but you fill out your goals. Like, are you struggling? Are you wanting to be more playful? Are you wanting to investigate? Are you trying to fix a problem? Are you trying to just explore? So it guides you through with, it will send you a scenario or a scene and then a box with curated sexual tools that will help you then recreate the scene or take part of the scene in your own way. And for a lot of couples, who have shared that they put sex in the back burner, it was no longer in the forefront, or they didn't even know how to start addressing it. By having a scene or an app or a tool, it took some of the pressure off and it brought the fun back into the bedroom. What I really want you to take away from today, it was so much fun having all the time I needed to answer a lot of your questions that you send my way, that you gave to me after I was on stage, is that sexual health care is healthcare. And you don't have to live with pain. It's very treatable. And libido is not a character flaw. It's not your fault. Orgasms are actually obtainable and trainable and supported by the right tools. You are allowed to ask for help. And I want to end with this. The World Health Organization recognizes sexual health as fundamental to overall health and well being, and that sexual health is connected to basic human rights. So hear me again, sexual health is connected to basic human rights. So if you have ever felt like you were too much because you were asking questions about sex or forbid pleasure, pain, or desire, this is your permission slip. You're not asking for something extra. You're asking for much needed health care. And if this episode hits home, I want you to share it with a friend who needs to take her pleasure seriously. And if you want a deeper dive, I can turn even more of these questions into a second episode. So reach out to me if you would love that. Thank you so much for tuning in to this episode of The Disruptor. If today's episode resonated with you, if you heard your experience reflected, validated, or even better, relieved, remember this: suffering in silence is not inevitable. We all deserve solutions that work, that honor our bodies, and that restore comfort without compromise. That's why we've highlighted Miracle Melts by Playground, products designed not just to hydrate, but to truly relieve painful symptoms, so you can move beyond just enduring. Don't forget, Disruptor listeners get 20% off their first order with code Dr. Sony. That's DRSOMI. And if you're looking for a little extra comfort, try one of Playground's FDA-cleared lubricants for dual action relief. You're not alone, and you deserve to feel good.